Today we will talk about anxiety disorder. So what are anxiety disorder? An anxiety disorder is a type of mental health condition. If you have anxiety disorders, you may respond to certain situations with fear and dread. You may also experience physical signs of anxiety such as pounding heart and sweating. It's normal to have some anxiety. You may feel anxious or nervous if you have to tackle a problem at work, go to an interview, take a test, or make an important decision. But an anxiety disorder goes beyond the regular nervousness and slight fear you may feel from time to time. An anxiety disorder happens when an anxiety interferes with your ability to function. You often overreact when something triggers your emotion, or you can't control your responses to situations. Anxiety disorder can make it difficult to get through the day. Moving forward, we will discuss about the types, causes, effects, symptoms, and treatment of anxiety disorder. There are several different types of anxiety disorder, including generalized anxiety disorder, phobias, social anxiety disorder, and panic disorder. With generalized anxiety disorder, you may feel extreme and unrealistic worry and tension, even if there is nothing to trigger these feelings. Whereas in panic disorder, if you have panic disorder, you get intense sudden panic attacks. These attacks often feature stronger, more intense feeling than other types of anxiety disorder. The feelings of terror may start suddenly and unexpectedly, or they may come from trigger like facing a situation you dread. Panic attacks can resemble heart attacks. If there is any chance you are experiencing a heart attack, go to the emergency room. Then come phobias that are intense fear of certain situations or objects. Some of these fears may make sense, such as fear of snake, but often the level of fear doesn't match the situation. Like with the anxiety disorder, you may spend a lot of time trying to avoid situation that may trigger the phobia. Some specific types of phobias include fear of animals such as spiders, dogs, or snakes, and the most common of them is cat phobia. Then there comes blood phobia, flying phobia, heights phobia, and there are many more. Now let's discuss what causes anxiety disorder. A mix of genetic and environmental factor can raise a person's risk for developing anxiety disorder. That includes stressful or traumatic events in early childhood or adulthood, certain personality trait, financial problem, any medical illness, drug side effects, use of harmful drugs like cocaine and heroin, or any emotional trauma or tragedy such as the death of close person. Certain physical condition including thyroid problem or some hormonal imbalance may cause anxiety. We will now discuss about the signs and symptoms of the anxiety disorder. Symptoms vary depending on the type of anxiety disorder you have. General symptoms of an anxiety disorder may be divided into physical symptoms, mental symptoms, and behavioral symptoms. Physical symptoms include dry mouth, heart palpitation, nausea, numbness, muscle tension, and shortness of breath. Whereas mental symptoms include feeling panic, fear and uneasiness, nightmares, repeated thoughts or flashbacks of traumatic experiences, uncontrollable obsessive thoughts. Behavioral symptoms include inability to be still and calm and trouble sleeping. Living with chronic anxiety can cause physical stress on your body, especially to your nervous, cardiovascular, digestive, immune, and respiratory systems. For example, long term anxiety and panic attacks can cause your brain to release stress hormones on a regular basis. This can increase the frequency of symptoms such as headache, dizziness, and depression. Anxiety also affects your excretory and digestive system. You may have stomach aches, nausea, diarrhea, and other digestive issues such as loss of appetite and constipation. If you experience chronic stress, your body never gets the signal to return to regular functioning. This can weaken your immune system, leaving you more vulnerable to viral infections and frequent illnesses. There are many different types of management plans available for anxiety disorder. That includes medication, therapies, lifestyle changes, and herbs. Medications cannot cure an anxiety disorder, but they can improve symptoms and help you function better. These include anti-anxiety medication, antidepressant, and beta blockers. Then there comes psychotherapies or counseling that helps you deal with your emotional responses to the illness. A mental health provider talks through strategies to help you better understand and manage the disorder. These approaches include cognitive behavioral therapy, eidetic therapy, and there are many other therapies available like systematic desensitization. You can also overcome your anxiety by taking small steps to change your lifestyle. This includes daily exercise, taking balanced and healthy diet, limit your caffeine, and take good sleep. I will make a detailed video to describe the types of anxiety disorder in detail. For now, if you like my video, please don't forget to share, like, and subscribe.